All right, welcome back. We are excited to go into our next segment of going beyond and empowering all PAs to recommend influenza vaccinations for their patients. And in this section, what we're going to be really talking about is the importance of the right influenza vaccination and really formulations and why that's important for your patients. And so I am joined again by our experts here, PA Takeia Horton, Dr. Sarah McQueen, and Dr. Melissa Soester. I'm very appreciative that this discussion is supported by Sanofi and really giving us an opportunity for us to talk about influenza vaccinations and why that's so important. So I want to shift a little bit. We're gonna, we talked a lot about statistics in some of our previous segments, and I want to talk about a couple of important patient populations, and then really this importance of vaccine formulation. So, let's talk about older adults and those with chronic conditions. And we heard in the last segment that we did that those folks are at higher risk for complication, hospitalizations, and death, right? So if you just took a look at among adults hospitalized with the flu during the most recent flu season, heart disease was one of the most common chronic conditions that patients had when they were hospitalized flu. And about half of the adults hospitalized with the flu have heart disease, okay? And studies show that flu illness is associated with an increase in heart attacks and stroke. Okay, and we all know heart disease patients and all of our patients with heart disease and some other conditions are at increased risk of heart attacks and stroke. But during flu season, that increases. And so when you talk about not only that, but some other complicating factors, such as older adults, right? Those who are 65 years and older, they bear some of the greatest disease burden that's out there. So I want to talk about this concept of formulation, because I think a lot of people don't understand this. And I think a lot of providers don't understand this, not just PAs, but physicians, nurses, anyone who works in the healthcare industry. It's not something that we talk about often. We often talk about, yes, you must get your flu vaccination, but we don't talk about the importance of formulation. And so I want to turn to my experts on the panel here. You have years and years and expertise, not only in vaccinations, but in emergency medicine and in family medicine. You have lots and lots of expertise in this area. So Dr. McQueen, I'm gonna turn to you and let's talk about formulation. Why is that important, and how do I know as a provider what type of formulation I have? And vaccines come to my office and we use them and on patients. So what are the things that I should be looking for? So I'll turn it over to you to kind of share some of your expertise in this arena.
It's very easy. We check a box and it gets done, and we have no idea where it came from. And so I would encourage everyone to speak to the magic person that does the buying and delivering to your clinic. Speak with them. Go into your medicine rooms where the nurses have the big fridges and freezers and store the vaccines. Take a look for yourself. One thing that there's the saying in family medicine, we're never going to be first. We're just going to try not to be last whenever a new thing comes available. And when there's a new vaccine or new recommendations, typically our clinic, we have to wait. When it starts as a may, we wait until it becomes a should, and then that's when we jump on it. And so that's what we're seeing recently, is that now these new formulations are should for our elderly population. And so that's just one thing that we have tried to do, is anytime there's a new recommendation, a new FDA approved vaccine, we really have meetings with the finances, the need, how it affects our population, which we have a lot of heart disease. And so it's adding to that, don't smoke, eat healthy, take your statin, get a flu vaccine. And so it's adding that to that recommendation.
We're going to get into some of the ACIP guidelines and recommendations in a second, into some of the specifics. But Dr. Soester, I wanted to turn to you, similar to the question that I asked Dr. McQueen about the formulations. What if I can't get a different formulation? Should I, as a provider, should I, say, you know what, go ahead, go home. Let me see if I can search for this. I'll call you back if we find it. Or is it best or better practice, I should say, to say, you know what, we're going to go with the formulation that we have and really get the vaccine in the arm right there, then and there for those patients. What are your thoughts in that arena?
I think a lot of it comes down to knowing what's going on in your community. So I have historically worked at practices where we did have high dose flu vaccines, and there were a lot of conversations about how many do we need? Did we have any left over last year, to make sure that we're kind of hitting those high points of what we need for our patients. If it's a situation where we don't have any high dose vaccine, and in the community, if we call around to other clinics, they don't have it either, I'm going to give to my patient what we have there, even if it's not a high dose vaccine and they're over the age of 65 or in a high risk group. It's better for them to get, the standard flu vaccine than not to get one at all. And there have been situations too, and depending upon the type of practice that a PA is in, maybe they don't have any flu shots at their office, or maybe they only have the regular, but they know other locations where maybe a patient could get high risk. We tended to call around and kind of know, listen, we don't have this vaccine, but here's a location you can go to. We write down exactly what it is that we want the patient to get and where they can get it. Because a lot of times if the patient goes home, you may not get them back. So really having, your finger on the pulse of what's going on in your community is very important.
It's so true. And, I think sometimes as healthcare providers, people don't realize kind of the burden of making those decisions with patients, especially when you don't have access to either providers or medication. And our patients that kind of suffer in this arena too, right? When they don't have access to these things, and what is your approach? So I think it's so helpful to hear that. And I want to talk about older adults for a second, and then I want to talk about the guidelines in a minute. But if we just took a look just at older adults, because there's a big focus right now on this, especially in the vaccine formulation. So during most flu seasons, right, adults 65 years and older, they have the greatest disease burden, right? I said that. So, but in recent years, it's really truly estimated that between 70% and 85% of the seasonal flu-related deaths, remember those deaths we talked about a couple segments ago, have occurred in people 65 and older. And between 50 and 70% of seasonal flu-related hospitalizations have really occurred among people in this age group. And so, the data doesn't lie when it comes to flu season and the importance of not only these chronic conditions such as heart disease and hypertension, which you just heard about here, but really this population of older adults. PA Horton, can we talk about the ACIP recommendations for a minute for adults age greater than 65, and really this vaccine complement? So can you share with us what specifically the recommendations are for these older adults?
So for the way I explain it to my patients is that the older you get, unfortunately, your immune system is going to decrease. So it's going to be harder for them to fight off all viruses, but definitely things like the flu. And so what they need is, while everybody else may get a standard dose of the flu vaccine, patients over the age of 65, especially those with comorbid conditions, need vaccinations with double, triple, or 4 times the dose of the regular flu vaccine. And the reason for that is because as you get older, you can't fight off viruses the same. If you add that on top of a patient with diabetes, hypertension, and heart disease, now they also are at an increased risk and can't fight off the flu as well. And so their body needs more of the vaccination at that time. I look at each individual patient and we go make a decision together. You are 70 years old with diabetes, hypertension, and you've had a history of breast cancer. You are almost at 4 times the risk as a 20-year-old with no medical problems. So what we do is I find out which pharmacies have those high-dose vaccinations if I don't have them in the clinic, and I send the prescription. I call the pharmacy and make sure they have it. I give a printed information to the patient and I'm like, you're leaving my office today and you're going to get this vaccination. You're not going home. You're not passing go. This is like a continuation of your visit if I don't have it in the clinic. And that's kind of how I educate the patient, saying, unfortunately, your immune response may not be that of a 20-year-old who's healthy with no issues. Now, and other people have said, if there's no community available, pharmacy available with any of these higher dose vaccinations, then we're going to give you what we have in the office because we want vaccinated across the board.
PA Horton, you bring up such an important topic that we could have a whole nother discussion on, which is having the importance of that relationship of the PA and the patient, and how it really is this shared decision making and for our patients, right? And our job and our role is to help share as much information for them to make a decision, and how you make a decision together of what's best for their health. And I think, and I'm going to pivot just a little bit, so hopefully that's okay. But I want to talk about this importance of communication and conversation. And, and I want to share, and I want to ask all of you to maybe share some insights and tips that you have, because I think we have a lot of new providers. We have a lot of new PAs coming in to the workforce. They're trained differently, right? We have a lot of virtual interaction. There's social media. There's a lot of influence that didn't exist when I was first a PA. You read the newspaper, or you got things in the mail, and now people are getting information in real time via social media and some other things. And so help our audience and maybe share some of your best practices with meeting people where they are, and having a conversation with them. I got 15 minutes to get everything in their health in this little window. How do I find time for having a conversation about the importance of something such as influenza vaccines? So, PA Horton, I'm going to go back to you because I think you gave us really the setup for this. So share with us maybe a story or your best practice of how do you talk to them, and what are some tips that you can give maybe some new PAs who are coming out into practice?
So my tip is, you want to treat each patient like a family member. So I imagine my grandmother, whose age I will never share, if she was sitting in front of me asking about the vaccination, I'm not just going to tell her, you need a flu vaccine, here, sign this consent, give it to her and walk out. There needs to be a discussion. And what I do is I sit down with the patient, I explain to them, this is what we're seeing in the community. This is why the vaccination is important. These are your personal risk factors, which make you more susceptible to severe disease. These are some of the complications that could arise, hospitalization. And then we discuss it. And it's really an open discussion. This is what I'm recommending. What are your questions? What are your thoughts? What are your concerns? If they're elderly or someone that needs additional people to help them make decisions, I'm like, do we need to call your family members or somebody you want on the phone while we're having this discussion? And what's really important is treating patients with the dignity and respect that they deserve, forming that relationship and rapport. And I know we're all short on time, but it may take an extra 10 minutes, but that 10 minutes is going to be well worth it when that patient knows that they were listened to, heard, had all of their questions answered, and now have a better understanding of why you even want them to get a flu vaccine.
Such good advice. Dr. Soester or Dr. McQueen, I don't know if you have any. After that, there was a lot of good stuff in there to unpack and follow up with. And I think everybody can take that as a lesson. Anything you either of you would like to add?
Some of it too is just remembering that your relationships with your patients can transcend that healthcare setting, and treating them like you had brought up, like they're a family member. You're never going to go wrong if you follow that policy, and always providing opportunities for the patients to ask questions or maybe tell you what they heard about it that may make them a little bit hesitant. And sometimes people may be hesitant at that moment, but if they know you're a safe person to talk to, you're going to listen to what they have to say, Maybe if they decline a vaccine, sending them home with information and letting them know this is always an open door. Even if you don't want to do this today, if you're a no today, here's some information, think about it. And if there are other questions that you have, we're here to help you. We're here to answer your questions.
I also love standing orders. It has really helped our practice so much. And so if you're at a practice that doesn't have it, and I know it sounds like we just shove everything off to our MAs, and yeah, sometimes we do, but it's great that you're also empowering them to make a difference in the patient's health. But it's also a teamwork kind of thing. And so a lot of times, we kind of get in a competition of how many nurses can give how many flu vaccines before the provider gets in the room. And so there's lots of high fives at the nurse's station, silly stuff like that. But then it's also if the nurse or the MA nurse has already talked about the flu vaccine, and then I go in and talk about the flu vaccine, there's sometimes where the patient's like, oh, fine, and I'm like, you know what, I'll take it. And we'll just, it counts. You're going to get your flu vaccine. And so I really love standing orders. They really, really do a great help.
And Dr. McQueen, can you share, a lot of people don't know what that means, I think, what standing order. And so could you just share with the group, if they're new, what
Absolutely. A great thought. And the CDC, as well as the different vaccine websites, have standing order forms that you can just print off and sign. And so what that does for your clinic is you're essentially giving permission to your nursing staff to, as soon as that patient walks in the clinic, they go through and offer all the vaccines that they're available to. Now, we do this with our childhood immunizations. We do this with all of our other adult vaccinations, but flu season is when, of course, we really focus on the flu vaccine. And so people don't have to have an appointment during that time. They can just walk in. They're here to get a toenail removal. They leave with the flu shot. And so it's really, and there's some education too, don't give them the flu vaccine if they're feverish or moderately ill, that kind of thing. But it really does empower your MAs and nurses to have that ability.
So, such an important topic. And like I said, we could have a whole nother discussion about empowering everyone in healthcare to really drive change. And I know we as PAs think about that often, and how we have so much expertise and we reach so many people, and the difference that it can make in people's lives. And I think all of you are a testament to so many things. So thank you for talking about this. We're gonna keep talking about this. So I want you to stay tuned, because we're going to talk about in our next segment some of those inequities that we talked about with vaccines, and different patient populations that really have a greater burden, and those that really struggle in understanding, but also just access. And so we're going to talk about some things associated with that, and what you can do, and some guidance from our experts here on how you can drive change in your own communities, especially among some of our most vulnerable populations. So stay tuned, and we'll be right back.